Hi, I will be showing how to put on a gown and gloves. I'm using winter gloves and a t-shirt for a gown, and I'll be showing how to wash your hands and then put those on. So first what you want to do is get antibacterial soap and you're going to want to wash your hands thoroughly with antibacterial soap. You're going to want to get under your nails like this, and then you're going to want to scrub all areas of your hands, the back, up to your wrist, with warm water. For about a minute. And then you're going to want to rinse your hands and dry them on a sterile towel. After you dry your hands, you're going to want to have someone help you, but I don't have anyone, to help me put your gown on. It usually goes on like that, but we're going to put it on like this. And once you have your gown on, you'll usually have your hands somewhat in the gown still, and you'll want to place on your gloves one at a time. Try not to touch the outside. And once you have your gloves on, you do not want to touch anything. So we're going to go back to our station that has already been sterilized to give a shot. And we will not touch anything while we go. Keep your hands up and away from your face and all other objects. And so now we are ready to give a shot. Hi, I will be showing how to put on a gown and gloves. I'm using winter gloves and a t-shirt for a gown, and I'll be showing how to wash your hands and then put those on. So first what you want to do is get antibacterial soap, and I'm so sorry. And you're going to want to wash your hands thoroughly with antibacterial soap. You're going to want to get under your nails like this and this. You're going to want to scrub all areas of your hand, the backs, up to your wrist, with warm water. For about a minute. And then you're going to want to rinse your hands and dry them on a sterile towel. After you dry your hands, you're going to want to have someone help you, but I don't have anyone, to help me put your gown on. It usually goes on like that, but we're going to put it on like this. And once you have your gown on, you'll usually have your hands somewhat in the gown still, and you'll want to place on your gloves one at a time, trying not to touch the outside. And once you have your gloves on, you do not want to touch anything. So we're going to go back to our station that has already been sterilized to give a shot. And we do not touch anything while we go. Keep your hands up and away from your face and all other objects. And so now we are ready to, give a shot. We have the sterile field all ready, and this is what I'm going to be giving a shot. And this is my needle. It has a cap on it, or my syringe, and it has a cap on it. And so I will set that down on my sterile field for now, and I will use an alcohol swab if I can get them apart to clean all around the area where we will inject, like so. Make sure it's extra clean so there's no possibility of sepsis or any infection. And then we will use our syringe. We will uncap it. We are not touching the needle. And then we will inject it into our patient. We will recap it and then put it into our sharps bin for biohazards. And they are all done. Next off, we're going to be undressing and redressing a wound. Again, this is my patient, And we are going to undress it. So we take the bandages off, throw them in a medical waste bag, and discard them. And then we are going to clean the area once again, probably not with alcohol depending on the wound, but we are going to clean the area. And then we are going to go with a Band-Aid, in this case, and redress the wound. And so I'm not allowed to waste Band-Aids, so I can't use it. I'm really sorry. But so we're going to redress it with our sterile gloves still and not touch the wound with our hands. And just put the Band-Aid on there. You can see it. And pretend it's stuck. Anyway, thank you for watching. Goodbye. All right, as you can see, I still have my sterile gown on and sterile gloves. And so after the injection and sterile dressing change, then you will take all this off and try not to touch your real clothing. So you will grab the outside of the gown and pull that off. And with that should come your gloves, but mine didn't. And you put that in a medical waste bin. And then you will grab the palm of your glove. Try not to touch your skin with the outside of the glove as you pull it off. But you don't want to pull it off all the way, because then you are going to use this as the way to grab this other glove and take that off. And once they are both inside out and none of the outside is showing, you will put that in the medical waste biohazard bin as well. All right. And everything has remained sterile throughout this whole process. And what you then need to do is throw everything you have used away on the patient and then disinfect again with your choice of disinfectant or the hospital's choice of disinfectant.